The government and private enterprise are the opposite. Think about it. If private enterprise fails to produce what consumers want or fails to return a profit to investors, it goes out of business. The government does not understand the need to satisfy consumers or investors because it doesn't produce anything.
The power to regulate interstate commerce, which is specifically given to the Congress in the Constitution, is the power to keep commerce regular between the states, to make certain that the states don't impose tariffs or absolute barriers to the entry of goods or services from other states.
Whenever you come into a new situation, you watch for rules.
This is Congress's favorite power under the Constitution, and it has used it to justify the regulation of everything from the water we drink to the air we breathe, to the strength of the flow of the water in your shower, to the size of your toilet bowl, to the number of legs that a desk chair needs to have in the workplace. But there is an area of interstate commerce where Congress has specifically said to the states, we will not regulate, and you may erect barriers, and you may impose tariffs, and you may prevent out-of-state commerce from coming into your state, and that's in the case of health care. Each of the 50 states is authorized by an express act of the Congress and by the Congress's implicit refusal to do anything else about this, to prevent out-of-state insurance carriers from selling health insurance in their states.
Imagine having an exceptioner in the library to decide that one person doesn't have to bring books back, but another one does.
So if I live in New Jersey, which is where I live, I can only buy one insurance policy, which is the Rolls-Royce of insurance policies. It requires me to pay for health services that I biologically will never be able to use. I should be able, because I have the natural right to enter into a contract, a binding agreement with whomever I want, as long as that agreement doesn't harm somebody else's rights. I should be able to buy a piece of a policy from Texas and a piece of a policy from Idaho and a piece of a policy from Montana and put together the policy that works best for me. Isn't it odd that in an area where Congress has tried to regulate everything, claiming it's interstate commerce, it has refused to deregulate something as basic as health insurance? Try and buy health insurance from a carrier in a state where you do not live, and you'll run into this unnatural, unconstitutional impediment.